or revise whenever you feel to. Okay. Okay, right. So Assalamualaikum, very good morning everyone. I'll be talking about diseases affecting the mammary gland, or also known as other. So you can use the term interchangeably. Okay. Of course, when we are talking about mammary gland, the most common or the most important disease would be the mastitis, and I'll be talking more about mastitis later in your ruminant medicine. However, there are other conditions, other diseases that affecting the mammary gland that you should know. Okay, because there are other condition. Even if there's when you are developing a differential diagnosis, um, sometimes it might not be mastitis. Okay, you should have other differential. For example, if the mammary gland is swollen, so there might be another disease or another differential that you should include that other than mastitis. Of course, mastitis would have a prominent clinical signs like swollen, discoloration of the milk, etc. Okay, but other than that, you shouldn't ignore other conditions. For example, if there is any hematoma, fibrosis of mastitis. I mean, fibrosis could be an indicator of chronic mastitis. Okay, all right. So it's very important because this is the first part of learning about the mammary gland. Okay, so you should revise on the anatomy of the mammary gland. It's very important. Okay, go back to your anatomy, because if you understand the physiology, the anatomy of the mammary gland, it would be you would be more appreciative of knowing or learning about the diseases. Okay, so the milks, of course, mammary gland, the function of the mammary gland is to produce milk. It's actually a milk secreting structure. So it has a tip, okay, a tip, a duct system, and there's a lobes, okay, connecting to each other. And the major or uh, what do we call it? The basic component of the mammary gland that producing the milk is actually the alveolus or the alveoli. Okay, and you should know in cows they have 4 mammary quarters. Okay, the one part is called as quarter. Okay, in each quarter they have its own tip. So cows have 4 quarters. So you should familiarize yourself with this term. Okay, the 4 quarter, the left, the 4 right quarter, the 4 left quarter, the hind right quarter, the hind left quarter. So familiarize with all these terms because I would expect you to use these terms during your physical examination. You write down in your PMR form, etc. Okay. And of course, sheep and goats, they have 2 glands or 2 quarters with 1 tip each. Okay, so meaning that they have 2 glands or 2 quarters with 2 tips. In sows, it can be 12 to 14 tips, and sometimes they can have like with 2 glands, they can have like 1 tip for 2 glands. And in mares, they have 4 glands, but with only 2 tips. Okay, so familiarize yourself with the anatomy of the mammary gland. Okay, and this is just a basic structure of the in the inside of the udder or the mammary gland. I've actually gone through this in the surgery course with you guys. Okay, in VPK36, I cannot remember, 1-2, is it 1-2? Can't remember. Okay, so basically this is the alveoli. So a group of alveoli, they will form like a lobule, okay, and a group of lobules, they form lobe, okay, and then milk secreted from the alveoli will be, hold on, yeah, hold on. Okay, sorry about that. Okay, so meaning that after the milk is being secreted by the alveoli, it will be stored in this lobule, it will be transferred to the lobule, into the lobe, and then when the calf sucks, if there's any suckling effect, then the milk would be transferred into these ducts and into the other cistern. Okay, and then from the other cistern, it will be transferred into the teat cistern. And here, this is a teat orifice, and there's a teat sphincter to make sure that the milk would not drip if the calf is not suckling. Okay. And then you know that the support system of the udder is comprised of this ligament. They have the lateral, they have the medial ligament, and this altogether it is termed as the suspensory apparatus or suspensory ligament. And the one that is going to divide between the left and the right, udder would be the intermammary groove. Okay, so you know that the middle one is stronger than the lateral ligament, which is composed of elastic tissue, and with the lateral ligament, it is made up of the dense connective tissue. Okay, so this is just a revision of the anatomy of the mammary gland. So these are all the diseases of the mammary gland. Okay, of course, the most important one is mastitis, but there are other lesions, other conditions on the teeth and skin affecting both on the teeth or even on the other skin. There's also lesions only affecting the bovine teeth. Okay, lesions of both bovine teeth and udder. There's also an udder edema. There's also a rupture of the suspensory ligaments of the udder, agar lactea neoplasm, and other congenital defects. Okay, so I'm just going to give you like two to three examples of each of that condition. Okay, so when you do diagnostic approach to any conditions affecting the mammary gland, of course, the first one is to receive the primary complaint from the workers, from the farmers, from the client. Okay, and of course, you've learned the steps of doing the physical examination. So before you proceed with doing the physical examination, of course, you need to ask the farmers, you need to ask the clients, you need to ask the workers, the history of the farm. And if you're dealing with livestock, of course, you have to know about the farm, about the patient, about the farm, the whole herd problem. Okay, so you should ask important questions. I'm not going to go through again what are the important questions because you've gone through the history taking, the physical examination techniques during VPK 3612, 3613. Okay, so this is 3614, is very specific. We only talk about the conditions, the diseases affecting each of the system in the body. Okay, and after you're getting the history, you do the observations at the distance. Okay, look what would be the condition of the farm, condition of the herd, the condition of the group of the animals, and then you focus on the patient itself, on the affected animal itself. So you observe from the far first. Okay, and you do necessary things like taking the heart rate, taking the respiratory rate, looking at the appetite, looking at the general appearance of the animal. Okay, then only you proceed with the general examination. Okay, even though the primary complaint is very specific, even though it's actually okay, my cow has reduced the milk production, or the primary complaint can be like, I've observed there's actually a wound on the teeth. Okay, you know that it's very specific. You know that you should focus on the mammary gland. However, at this stage, you should perform, even though it's very specific, you should perform the general examination of the cow. You should start off your physical examination by taking the temperature, taking the pulse rate, respiratory rate, etc. Okay, so perform everything. I mean, you have to examine every system in the body. Then only you can focus on the mammary gland. So you do the examination of the mammary gland. If the cow is milking, if the cow is lactating, you can proceed with the examination of the milk. So you strip off the milk and see, is there any abnormalities of the milk? Okay, when you examine the mammary gland, observe. First thing is observe. Second is use your hand and palpate, okay, the entire structure, the entire udder, the mammary tissue, and then up to the teeth. Okay, to detect if there's any lesion, if there's any what do we call that, swollen lymph node, if there is any lump like a nodule. So you have to do that. Okay, observe if there's any lesion, if there's any wound, if there's any scab, etc. Okay, then you can have a look at the milk if the cow is lactating. All right. And then in order for you to come into your diagnosis, in order for you to confirm your diagnosis, of course, you can collect samples. In a case of mastitis, perhaps you would like to collect milk, all right, and perform any other diagnostic tests. Sometimes you might, okay, if the animal is having like systemic signs, perhaps you would like to take blood and send it to CP or just to have a look at the serobiochemistry or even hematology parameters. Okay, and after you've done your physical examination, of course, you should have a list of your problem. Okay, I hope you are just like DVM4 kan? Okay. Later on, if you've gone through your rotation, so this is actually step by step. It applies to any species. So after you've done your physical examination, you should have a problem list, a list of problems, okay? So from each of your problem, you should come out with your own differential. So this is when you develop your differential diagnosis, okay? Certain times you might not be able to send samples to the labs, but somehow you have to come out with your tentative, at least tentative diagnosis. Okay. If you're able to send samples to the lab, of course you can confirm your results based on the test result, based on the test that you've run in the labs. Okay. And then you can come out with your final diagnosis or even your tentative diagnosis. And in the meantime, you don't have to wait for the lab's result. Okay, but you can just proceed with your treatment. So this is called as a supportive or even what do we call that? Treatment that is according to the clinical signs. If the animal is having high temperature, of course, you would like to give NSAIDs. Okay, treatment and care. So you can actually proceed with treatment and care. All right. So please appreciate, because at this stage here, you should appreciate what would be the normal anatomy, the normal tissue looks like. So this is a normal, healthy picture of the anatomy of the tip. Okay, so it should look like this, right? Okay, any questions so far before we proceed with this subtopics? Okay, so feel free to ask in the chat. I'll check the chat box later. Okay, so these are the lesions of the tip and other skin. So meaning that you can actually find lesion on the tip and also on the other skin. So this is most common in dairy cattle, which can actually cause pain and milking discomfort because they have lesions. So what you can actually do is that you can inspect. Okay, you have to have a look at the tip. Hold on, my cat is making such a noise. Okay, so what you can actually do is that you have to inspect, okay? I've mentioned this before, you have to palpate, okay, everything. Have a look at the tip canal orifice if there's any scab. So if you suspect like more serious problems, you can actually use water. If you have like a normal saline, you can use normal saline. And just to make sure that you wash off, because sometimes the teeth can be very dirty, okay, because you want to inspect. It's just not by having a look at just like that. Sometimes it's very dirty, sometimes you might want to inspect more closely. So you can wash the teeth with water or even the normal saline, superficially irrigate and wash, okay, so that you can have a look at a clearer picture. Right, so one of them, have you heard of foot and mouth disease? FMD is very common, it's endemic in Malaysia, but I haven't seen case of FMD for such a long time actually. So this FMD, the lesion, if the cow is having FMD, of course it doesn't only affect the tip or the mammary gland, it also affects other areas like the coronary bands, the muscles, tongue. So what you can actually observe is that it would have like a vesicles, bullae, and if the vesicles ruptured, you can actually get the ulcerated areas. So please, again, be familiarized with all these interhuman dermatological term, vesicles, erosion, ulcers, apa lagi? papule, macule, pustules, etc. Because I'll be talking a lot about that in this topic here. But FMD may resemble as the bovine herpes mammillatis, okay? But other than having these skin lesions on the teeth or even in the udder, the animal might be having other systemic signs as well. So the animal might be having anorexia, pyrexia, salivation, edema, and mastitis, okay? So this is just an examples of vesicles on the here, okay? Ruptured vesicles. Over time, it will heal. Okay, after it's ruptured, after the vesicles have ruptured, so you have like a ulcerated area on the near the teeth orifice here. Okay. Right. Other than that, you would have also the condition called the necrosis of the skin at the tip in the newborn piglets. So this one here happen if the piglets are raised on the very hard concrete flooring. Okay, but farmers would not notice this at the earlier stage. So what would happen is that later on, after they got pregnant and etc. So that part of the teeth would not be working. Okay, so you know that it would no longer be working because it has a necrosis. And there's also lesions of contagious ecthyma or of in lactating ewes, which is transmitted during suckling of the lambs. Okay, so meaning that the lambs have got this virus. So when they suckle, it would transmit to the dam, okay, to the ewes, and then they would have this kind of lesions, okay, of. And we also have this ulcerative dermatosis in lactating ewes, which if this happens, sometimes it may proceed, it may also cause subsequently mastitis. Okay. All right. So if you're talking about lesion of the bovine teat, lesion that only affect the bovine teat. So there are few of lesions affecting the teat end. Okay. So these are all the examples: the eversion, prolapse of the meatus, teat and erosion. So it's normal if the cows is being milked by the machine. It is normal if you just inspect closely. It's normal to observe about 2 millimeters white ring around the teat orifice. But somehow, if there's something wrong with the machine, if the vacuum, if the chamber, if there's something wrong, if the all of this, like the excessive vacuum levels, if there's faulty of the tip cup liner, so these can contribute to the hypertrophy, keratinization, and radial cracking, which can lead to secondary bacterial infection, which can lead to scab formation and also teeth orifice erosion. So it's very important to make sure that the machine milking is in good condition. There's nothing wrong with the vacuum, tip cup liners, etc. to avoid this lesions affecting the teeth end. Okay. So this is just to show you an examples of a tip. Okay, how does it look like? If there's no ring, it should be like this. So if there's a hyperkeratosis, hypertrophy of the teeth orifice, so it would look like this. Okay, so of course this would affect the milking. So there's another condition called black spot or black pox. Okay, so this is when there's actually an ulcer. Okay, it's very prominent ulcer, but at the center of the ulcers, there's actually a black spot. Okay, usually it would confine to the tip of a tip. And because this is usually caused by the bacteria, so it actually can goes inside the tip. Okay, so these are the common bacteria. Okay, Fusobacterium mucoforum and also the Staph aureus. So what you can actually do is that you can apply any ointments stated here, right, topically. So this is an example of the black pox. Okay, it's ulcer, but in the middle here is like a discoloration, black discoloration. Bear in mind that sometimes animals, they would have like a pigmentation of the teeth. Okay, sometimes the teeth would appear like a blackish in color. So don't confuse that with gangrene. Okay, just make sure that some animals, they do have the pigmentation, okay, but it doesn't mean anything. It's just that the color of the skin. Then there's another condition called pseudocowpox, okay, which is caused by the parapox virus. What it can actually do is that it's very painful with edema and erythema, and sometimes it can produce exudate. Okay, So it would start off like a small orange papule, and then it would elevate it. It appears like a small lesion with a dark red in color. And then later on it will produce scab. So usually the scab would form like a horseshoe shape or circular in the shape, circular shape. Okay, so this is an example, okay, of a pseudo cowpox. There is actually a bovine herpes mammillatis, or also known as a BHM. So this one here, it has these vesicles, edema, erythema of the teeth, and then if the vesicles rupture, it would produce erosion. So if the vesicles rupture, it would also produce a very a copious amount of serous fluid. And this one here is a bit serious because the animals are having systemic signs. They would have a fever, depression. So if you would like to detect, is it really herpes virus? So of course you can do virus isolation and serology, but most of the time it would not be visible, it would not be practical. So you can just treat accordingly using the topical antiseptics. And just make sure that you apply all these standard control mastitis measures. Okay, so this is actually an examples of the BHM. As you can actually see that it also affect the teeth and also a bit of the udder, okay, at the junction here between the udder and the teeth. Okay, there's also a condition called a rupture of the suspensory ligaments of the udder, which happen in the adult lactating cows. So this is caused if the after calving, it's normal to have this udder edema. So it's not pathological edema. It's more like a physiologically happen after calving. But if it gets severe, because of the excessive weight of the udder, so it can cause breakdown of the suspensory ligament. So what happened is that the mammary gland would just drop, and while the animal is walking, it would cause like friction or even an abrasion of the mammary gland. Okay. And these are a list of neoplasm affecting the udder. It may be rare, but it can have a moderate malignancy. So if it's fibrosarcoma or fibroma, usually you would just surgically excise the tissue. And in mares, you will get malignant mammary carcinoma. Okay, and in Toggenburg goat, we can have mammary adenocarcinoma or even ovarian granulosa cell tumor. Okay, and it's very common also to get this viral papillomatosis in cows. So this is an example of papillomatosis. It's like a wart, okay, on the tip of the cows. And this is actually examples of congenital defects, supernumerary teats having more than one teat, okay? Fused teats, meaning that it looks like it has two teats, but it's actually connecting to each other. I mean, it fused, okay? Hypomastate is that the underdevelopment of the mammary gland in adult animal. Sometimes the animals might also be having absence of the tip canals, tip sinus, absence of the connection between the tip sinus and the other sinus. So if this happen, meaning that the mammary gland would not be working, would not be functioning. Okay, so this is an example of the fused tip. It has two tips, but it's actually connected to, or it is actually fused to each other. Okay, so one might be working, but one might just be an accessory tip. Okay, do you guys have any questions so far? Okay, can we proceed with bovine mastitis? Yeah, okay. Right, so bovine mastitis, of course, is actually inflammation. It's simple as that. Even though it's simple, it's a simple definition, but it's a very complex disease. It's a very complex disease in terms of controlling, putting all these preventive measures, control measures, etc. It's very, very hard to control the incidence of mastitis. So what happened is that when you're talking about the bovine mastitis, inflammation of the mammary gland, three things happen. It might be abnormalities of the mammary gland, of course. It would also be abnormalities of the milk. And third is that abnormalities in the animals itself. Okay, so many things can happen. Clinical signs, the major one is, of course, we're talking about the mammary gland. I've mentioned here 5 signs of inflammation. So there would be increase in the temperature, okay? It would be increase in the size, swelling. There would be pain, sometimes edema, loss of function, okay? So other than that, milk would be discolored, okay? There could be a presence of clots and also large number of leukocytes. So have you heard of somatic cell counts before? So somatic cell counts is actually a type of leukocytes. However, okay, those that I've mentioned before is called as clinical mastitis, those with clinical signs, a very prominent clinical sign. So that is clinical mastitis, but mastitis can also happen subclinically, whereby there would not be any changes of the mammary gland, there would not be any changes in the milk, there would not be any changes in the animal itself. However, when you send the milk to the lab to look for the somatic cell counts, for example, or if you send the milk not really by culture lah, but if you send it for the leukocytes, you can actually see a very high amount of leukocytes. Okay, so in order for you to diagnose if the cow is having subclinical or not, so you can perform this SCC. Okay, you can also look at the electrolytes level, such as the sodium and chloride. You can also check for this kind of enzyme called N-acetyl beta glucosaminidase. You can also perform the acute phase protein. These are actually the acute phase proteins, haptoglobin and milk amyloid A. You can also do lactose or even this LDH, okay, in order for you to confirm whether the animal is having subclinical mastitis or not, okay, because increase in SCC would means that there is actually increase in neutrophils, and hence you can see that this animal is having subclinical mastitis. So these are all the etiological agents of the mastitis. So it can be contagious pathogens. It can be because from the thick skin, opportunistic from the environment, or also uncommon. So I hope that you would be able to give, you could memorize lah. I'm not going to talk more about this, but later on in the ruminant medicine, I'll be expecting you to memorize. There will be the coagulase, negative staphylococci, etc. So you should be able to name all these what do we call that, all these bacteria. Okay, so if you're talking about contagious pathogens, these are the pathogens that can be transmitted from the hands of the milkers. Okay, if they don't clean their hands, okay, or if they use the same cloth, okay, meaning that they have cloth and then they would use one cloth, the same cloth from one animal to another animal. So this is how contagious pathogens can be transmitted between cows to cows. Okay, the transmission would be from cows to cows. So thick skin opportunistic pathogens, this is usually the pathogens that can be found on the skin, okay, on the skin of the mammary gland. However, because of certain conditions, if the immune system is down or whatsoever, so this kind of pathogens will be able to cause mastitis. And of course, environmental coliforms, E. coli, Klebsiella, and you also have Strep uberis, Strep dysgalacti, Acanobacterium pyogenes, whatsoever. So these are coming from the environment. If the environment is dirty, you are not taking care of the environment, the bedding, etc., flooring. So these can also cause mastitis. And of course, there are other uncommon bacteria such as Nocardia, Pasteurella, Centrobacter, etc. Or even fungus can cause mastitis. Okay, so these are the methods of transmission. Usually it would be coming from the environment. Very rare if you get mastitis from the blood, for example. If you're saying that the animal is having septicemia, for example, and then it comes to the mammary gland, I don't think so that's possible, because from the blood stream into the mammary gland, you would have this barrier, okay? So usually the pathogens would not be able to what we call that, to be transferred through this barrier. Okay, most of the time it would be coming from outside through milking, then the bacteria would be able to gain the entrance through the tip end. Okay, of course originated from the infected udder, from the environment. So these are all the source of infections. Okay, even the machine milking, even the milker's hands, even the cloth, for example. all these can be transmitted into the susceptible animals. Right. So these are the clinical signs. I've mentioned these. You can get either one of these. Okay. There will be abnormalities in the milk, abnormalities in the udder, or abnormalities in the cows. Okay. So it can be categorized according to the severity and duration. If there's abnormalities in the milk, the best way to look for abnormalities, because milk is white in color, correct? Okay. If you have like a paddle or like a bucket, black in color. So if you strip the milk, you will be able to notice if there's any changes. Okay, if you use, because I think the one that we have, the CMT paddle that we have in the ward is white in color. So sometimes if it's just clots, you would miss that. Okay, unless if there's a discoloration, if there's changes, is that if there's any reddish in color, so you would be able to appreciate that. But if you use like a strip cut black and shiny, you would be able to detect if there's a clots, if there's a flakes, if there's purulent materials or discoloration. So discoloration can be blood, stain, or very watery. But don't confuse this with the milk, which is being stripped the first few days after calving, because usually they would have these black clots, and usually you would find like a small plugs of wax. Okay, it's not mastitis, it's normal. In the membrane tuberculosis, sometimes you can have flakes at the end of the milking. Okay, I don't have a picture of flakes, but later on, I hope that you should be able to detect what flakes. It looks like a snowflakes. If you've seen snowflakes, it's like a kepingan, like a, yeah, flakes, but not that big, very small flakes in the milk. Okay, and if the cows is in their dry period, it will turn from a normal milk to a very clear watery fluid into the honey-like, and then it would form a colostrum. So again, colostrum is normal. I know that you would not be able to get experience in detecting colostrum later on, but don't confuse colostrum with milk with mastitis, from the cows having mastitis. Okay. And of course, abnormalities in the gland, you should view the mammary gland from behind. Okay, before you touch the animal, before you palpate the mammary gland, you should stand behind the cow, so that you can actually appreciate the symmetry, if there's any changes in the size of the mammary gland. Okay, symmetry is very important. Okay, and then palpate the whole gland, inspect, and also palpate the teat, and don't forget the teat, and palpate the supramembrane lymph nodes. So supramembrane lymph nodes would be located at the caudal part of the mammary gland. Later on in the practical, I'll show you how. So don't forget to palpate that. Okay. Sometimes you might be able to detect like a very small lump around like 1 to 2 centimeters. So sometimes it would be fine if you don't detect any other changes. But if there's any changes, if they detect, if there's any like a very big swollen lymph node, then that would mean something. Okay, so other than having inflammation, okay, because when you talk about inflammation, it's reddish in color, there's heat, there's swollen, there's pain. Okay, sometimes the mammary gland would be hard upon palpation, hardened tissue. Okay, so that could be because of the fibrosis. In chronic mastitis, usually at the end of at the later stage of the chronic mastitis, the mammary gland tissue would become hardened. It would harden. So that is called as fibrosis. So fibrosis can occur as diffuse or local. So if it's local, it will be like a very small size, okay, to even a size of the fist. Okay, diffuse mean it can be all over the mammary gland. So that's why it's very important for you to palpate the mammary gland. In acute inflammation, the swelling will be diffuse. Of course, there will be a presence of heat, pain, abnormal secretion. And there's also a term called as atrophy. So meaning that it reduces in size. Usually happen also in the chronic mastitis. At this stage, the mammary gland would not be functioning. There's nothing else you can actually do because it's already atrophic. All right. So if there's any abnormalities in the cow, of course, you would get these systemic signs. The animal might be having toxemia, fever, ruminal stasis, depression, recumbency, anorexia. So this is a type of mastitis that is very severe. Usually happen if the animal is being affected with these coliforms, okay, E. coli, Klebsiella, or even Acanobacterium pyogenes. Okay, you can classify mastitis according to severity. So these are all the what do you call that? The classification per acute, acute, subacute. But you don't actually use this when you put your diagnosis. I don't expect you to say that, okay, this is a per acute clinical mastitis. So this is subacute clinical mastitis. You don't have to do that. This is just for your information. Okay. This is not really important. Okay. You don't have to put this as one of in your final diagnosis. Okay. Or it can be also classified according to the duration. If it's short term, usually caused by these environment pathogens like E. coli, Klebsiella. If it's recurrent, usually it is caused by the contagious pathogens such as Staphylococcus aureus, Streptococcus dysgalactiae. And if it's persistent, it can cause by this kind of pathogens. Okay. Right. For the diagnosis, of course, the most important part of having to diagnose mastitis is by doing the physical examination, by doing observation, by doing palpation, by doing anything, everything. And then only you would proceed with taking samples, and then you would send it to the bacteriological lab for the culture. Okay. And then of course you might want to proceed with the antimicrobial susceptibility testing. So this one here is that it's very important because you would like to know what are the antibiotics that can be given. Okay, because certain pathogens, they would be resistant towards certain types of antibiotics, so that you would have problem in treating these mastitic cows. But of course, it would take time for you to wait for the lab results and etc. So I'll be talking about, so that's why I've mentioned this to you guys, because this is very complex disease. It doesn't mean that once you know that it's bacteria, then you just proceed with giving like penicillin, for example. No, it's not as straightforward as that. Of course, it is caused by bacteria, and of course you would be treating mastitis using antibiotics, but most of the time it failed. Most treatments fail because of many things, many factors would be playing the role in making sure that that's why the animals might be having like persistent or recurrent mastitis. Okay. But it's very important, if you have the access to the labs, please send your samples so that you can actually determine whether or not to proceed, because not all mastitis can be treated with antibiotics. Okay, but I'm not going to talk about that because it will be later on. But the principle is that, of course, it is caused by bacteria, and of course, you would need antibiotics to treat this. Okay. Yeah, this one here is that, of course, to detect the subclinical mastitis, of course, because if you're talking about dairy cows, yeah, dairy cows is actually being kept in the farm, so they would be like a large number of animals. When you talk about mastitis, you cannot say it's actually individual problems. Usually it would be a herd problem. It would not be worthwhile if you just take samples from one animal. So usually you would need to take samples from the bulk tank, okay? The milk, after they've milked all these like 13 cows in the farm. So they will keep the milk in the bulk tank. So what would be more appropriate, what would be more practical is that you can just take the samples from the bulk tank. Okay, this one here, bulk tank. And then you can send for milk somatic cell counts, and also to do culture. Okay, so this is the easiest way if you observe many animals are affected at one time. Okay, but if you're dealing with like one animal, you're dealing with a smallholder farmers, only one or two animals affected, of course you can just take the samples directly from the cows. Okay, of course you can culture. There are also like indirect tests. CMT is very common, California mastitis test. Okay, so this is very common. It's a cow site test. Very easy, very inexpensive. You can just carry your CMT reagent, your CMT pedal everywhere. Okay, and once you detect, you can just perform CMT. But if you notice that the animals are already having these clinical signs, you don't have to do CMT. CMT is only meant for subclinical mastitis. Okay. For example, if the farmers complain to you that, okay, my cow is not producing as many milk as before. So that's the only complaint. And when you check, when you do your physical examination, there's nothing wrong. There's no swollen, there's nothing. The animal seems perfect. Then only you can proceed with CMT, and yeah, so that can actually tells you whether the animal is having subclinical or not. This enzyme analysis or even electrical conductivity is not, it's not something that we do regularly. We don't actually have this, not even in UVH, not even in VLS. We don't actually do this. What we did is actually, what we're doing right now is actually the CMT, only the CMT culture. Even mixed somatic cell counts, we don't actually do that. We don't have cell counters. We don't actually send milk to CP lab even to do cell counters. Okay, this is only available in certain labs. Kalau dekat Makmal Susu Melaka, if you notice that the DPS, they have this Makmal Susu Melaka, so I think they have the cell counters to look at the somatic cell counts. All right, so other diagnostic tests would be, if the animal is having systemic signs, of course, you can send the blood to hematologist, run biochemistry, you can do ultrasound, you can do biopsy. But these two here only necessary if it's really practical. Biopsy is like more research based, or if you detect if suspect, I'm not sure. This is not something that we would do. Okay. Yeah, because other tests would be more feasible. And in terms of a treatment, you're talking about bacteria, of course, antibiotic, affecting only the structure of the mammary gland. The best is actually to use intramammary infusion, antibiotic infusion, not really parenteral, the one that you would inject intramuscularly or even subcutaneously. Okay, the best is intramammary. But most of the time, if you notice, I'm not really sure because you don't have enough experience in the ward. We do lack of having this intramammary antibiotic. So most of the times, clinicians would opt for the parenteral. But if you have this intramammary antibiotic, please use this intramammary infusion antibiotic. Okay, one of the examples is cefepime or ceftiofur, which is used against to treat coliform mastitis. But when you perform this intramammary infusion, make sure that you would be taking appropriate steps just to make sure that you would not introduce any bacteria inside, because you are basically opening up the tip end. Okay. Later on during the practical, I'll show you how. Okay, so these are all the step-by-step how to infuse the intramammary antibiotic. Okay. And of course, you can use parenteral only if the cow is having systemic signs. If the animal is having depression, is having fever, then it would be worthwhile to give parenteral. Okay. Or if the gland is very swollen, okay, very swollen, even if you detect if there's a fibrotic tissue in the mammary gland, so sometimes intramammary antibiotic would not be effective because there's no active inflammation first, and most of the mammary gland is composed of that tissue, fibrotic tissue, so it would not be practical to do that. Okay. Use higher than normal dose rate daily for 3 to 5 days. You can do that, okay, for 3 to 5 days, just to make sure that the amount of antibiotic would reach to the mammary gland. Remember that the drug is injected parenterally, okay, IM. So it's not really into the mammary gland. So sometimes you would not, you would need to have a higher than normal dose. So it's up to your jurisdiction. Okay, and make sure because all these antibiotics, they have this withdrawal period. So just make sure that you would be telling the farmers to follow the withdrawal period, okay, according to the drugs. Other supportive treatment like anti-inflammatory, you can give NSAIDs, you can give flunixin, most of the time flunixin lah, okay. If you suspect the animal is having toxemia, dehydration, so of course you can proceed with IV fluid, or if there's any adjunctive therapy, sometimes people would just give oxytocin just to make sure, because they would think that they would need to strip off the milk as often as possible because, yeah, because of the bacteria inside the mammary gland. All right, so this is dry cow therapy, okay. Don't get confused with dry period, okay. Dry period is actually a physiological phase in dairy cows. So dry cow therapy is that when you give antibiotics immediately after the last milking of lactation, before you start the dry period. So this is actually the function of having dry cow therapy is that you would decrease the number of existing infection if there's an infection. Okay, and at the same time, you would be preventing any new infection during the early weeks of dry period. So it can be blanket dry cow therapy or selective dry cow therapy. Blanket means you would give on all 4 quarters. Selective means you can just choose like whichever quarter that you would think that need more for the dry cow therapy. Okay, so in the dry cow therapy, the type of antibiotics, it has a higher levels of antibiotics in a slow release base. So usually the intramammary antibiotic, they have 2 types. One is for the lactating cow and the second one is actually for the dry cow. Okay. Right, I'm not really sure if we can, because we only have like 5 minutes left. This is just a video, okay, how to look at CMT, the dry cow therapy. I think you can just go through this. I hope, kejap. The one that I've sent to you is actually in PDF kan. I'll upload, I think I'll just upload the PowerPoint lah so that you can actually watch this. Okay, I've done some amendments on these slides. So later on, I'll be uploading the updated one in your Putra Plus. Okay. All right. I'll upload this in the PowerPoint so that you can actually have a look at the all these videos here. Okay. So Liana, have you checked when is the practical for mammary gland?
Yes, doctor. But you are supposed to have practical on next week, right? The back, the intern told me that next week will be with Dr. Khor and you will
Okay.
be before.
So when will you guys?
Dr. Rozaihan, I'm here.
Oh, hi Dr. Khor.
Doktor Intan dah beritahu saya we will swap.
Okay.
So
Mine will be?
yours will be, I have to open up the schedule. If you open up the schedule, you swap with me the one on the upper end of November.
End of November. Okay, okay. All right.
So I think you will take the 24th.
34th. Okay. So that time you guys will be back, guys. Students will be back campus.
Students, will you be back already that time?
Yes, supposedly we are already back because we are back at 8 on 8 November. So
Okay, next week lah. Okay. All right. Okay, sure. Okay. All right. Stop sharing. You guys have any questions? Okay. You guys can always email me, WhatsApp me, I don't mind. If you guys have any questions, and then the materials for the practical I will be uploading soon in the Putra Blast as well, because we'll be having our practical in Ladang 16. Okay, unit Tenusu. So I'll be itulah, because your practical slot will be like one time. You guys are like hundreds over. So we'll see how if we can just divide into two groups, so the first round will be stayed in the, yeah, I'll think about that. Okay, all right. So thank you guys. Okay, Dr. Khor, is this your class after this?
I will continue from here lah, but do you need to stop record or kita teruskan haja record?
I
Terus.
can continue the record, but this one here will be
They
in my,
will change the host to me ke, I think.
boleh I
How ah?
change, I can actually, because this one here I'm recording, but the recording will be saved in my laptop. So I can,
Yeah.
oh, jap. I
Or maybe
think,
you stop record, then I will record again, no?
okay, all right.
Then you
Very
can
good.
go and have lunch and stuff like that.
Okay, all right. Stop. Okay, I'll leave now. Okay, thank you guys.
Okay.
Bye.
Thank you, Doctor.
All right.
Tidak ada.
Okay, students, can you see slides?
Yes, Doctor, we can see the slide.
Okay. So I know it's already lunchtime. I know you guys are hungry. Like, all right. Okay. So if you wish to eat or you wish to, as if like you are in a TGV cinema or whatever it is, you wish to eat while you're listening to the class, then go ahead lah, huh? No point being very angry and hungry. All right. So I'm sure most of you have already seen the panggil apa, the briefing before you come for the class. Correct? Have you all?
Yes, Doctor.
Okay. I wish my lecture would gonna be as interactive as possible lah, huh? Okay, so if you decided to just stop me halfway, then by all means, stop me halfway just for queries, questions and answer. Okay. So what we're gonna do is today we'll just go through a briefing. So go through a brief overview of cardiovascular system. Okay, so then after that, we'll roughly know what is available and what is not available out there lah. Now, before we start, can I have a quiz first? So what do you think is this valve? What's the name of this valve? Mainlah, jawablah saya. Kalau tak ada boringnya. Mitral valve. Okay, then what is this valve? I don't want such thing as bicuspid. You want to say bicuspid or whatever it is, that's in your pathology. For cardiovascular, we're going to name the specific valve name. So just now this is mitral. Just now somebody typed aorta. So this is the left side of the heart or the right side of the heart. Tak mau bicuspid, no abit. So this is left side of the heart. Left side of the heart always tends to have a thicker muscles wall. Okay, so theoretically left side, so this is going to be the right side lah. Okay, what would be this valve name? What is this valve name? Hello?
Bicuspid.
Huh? Bicuspid ke tricuspid? Tricuspid. Then this one?
Pulmonary.
Pulmonic.
Pulmonic.
Okay. Then this chamber leh?
Left
Left.
atrium.
Okay. Masuk sini. Blood will go into the left upper knee chamber.
Ventricle.
Okay. Okay. Then blood straight away will go to the main aorta lah. Right? So what's this chamber name pula? If this is going to be the right side of the heart.
Right
Right
atrium.
atrium.
Right atrium goes into the
Right,
right? Ventricle and out go to the pulmonary artery. So actually you have already got the answer in your lecture notes. You can just read it and go along with what we have today. Okay, so all these structures are actually very important for you to identify. Yeah. All right. Now, when it comes to cardiovascular diseases, signalments are very important. Cats have got their own sets of heart diseases. The dogs also have their own sets of dog diseases also as well. Whether they are young or they are old is also very different. Okay, so they have their own different sets of differential. Breeds are also important. There are certain breeds which are predisposed to the disease. There are certain breeds which are not. Okay, for example, you know, the Maine Coon cat tends to have hypertrophic cardiomyopathy. Or maybe, for example, the small breed dogs tends to have mitral valve diseases, whereby the large breed dogs will tend to have dilated cardiomyopathy, which is the wall diseases. So it also depends lah. Okay, but anyway, this segment make our lives easier in terms of the differential. Then, as in like sex, whether it's going to be male or female, it's very hard to say. But congenital diseases tends to happen in female, so it depends lah, right? Okay. Every cases that comes in, they always have got a primary complaints, and their primary complaints would also be, you know, in different sets. But normally for cardiovascular diseases, it's going to be coughing. Okay, but please put a little note there. Cats are not supposed to cough. If a cat coughs, it's always a respiratory issue. Okay, coughing in dog, straight away when you think about it, you have to you have to think about respiratory issue and heart diseases. All right, cat that have got heart disease normally will not cough. They have other presenting clinical sign, and often it's going to be panting. Okay, so dogs or cat with heart diseases, they tend to be tired, they tend to be fatigued. Some of them may have dyspnea. What is dyspnea?
Difficulty in breathing.
Okay, good. And some of them may even syncope, collapse. Some of them may even have altered behavior. Okay, sometimes this patient at end stage of the disease, they'll come in presented to you with abdominal distension. But abdominal distension has got many other differential also as well. So you just need to find out lah which one is it. And some of them may have paralysis. Okay, y'all can hear me clearly also as well, right? Besides that, I'm wearing double mask.
Yes, doctor.
Okay, okay. Let's move forward to cough. Cough is a sudden forced expiration, and often cough is like a normal defense mechanism lah. What do I mean by it's a normal defense mechanism? Faham tak? What do I mean by it's a normal defense mechanism? Don't know, don't want to say. Nobody want to think.
Doctor, because we tend to, whenever there are like pathogens or something, we tend to cough out.
Not really pathogen. Let's say if there is irritation in the throat, will you cough?
Yes.
Yes.
That's,
So
yeah.
so it's like whenever you don't feel well, it's a defense mechanism. You straight away cough it out. Okay. So cough is typically like how you cough. So cough in cats and dogs, the sound are actually very similar to how you sound like also as well. But with cardiac cough, it's a little bit different. Okay. So just now I say cough, you always have to think about respiratory and cardiovascular also, correct? Normally with respiratory disorder, it's always acute. It happens suddenly. Okay. But with cardiac problems, it used to be the auntie will tell you, it used to cough 1 month, maybe once lah. Then you know it suddenly gradually happened like 2 weeks or he will cough, but some days he won't cough. Now all the cough is so bad. And all this baby has gone for, you know, like maybe 5 months. And then maybe the first cough or the second cough or the initial part of the cough wasn't worrying to the owner. Okay, so chronic cough tends to be, for cardiac diseases, tends to be chronic. It will take some time. Okay, now, characteristic of cardiac coughs, they tend to be harsh, low pitch, and there is a gag. So I'm going to demonstrate. What does the cardiac cough sounds like? Sorry, yeah. Excuse me, yeah. Right? So that's how the dog will sound like when they cough. There is a gagging at the end of the cough when they're trying to clear the throat. So owners sometimes can tell you, coughing after drinking or coughing, didn't do anything, sit there only, just woke up, suddenly cough. All right? So those are the clinical signs, like histories that you will get. So often we will radiograph. Kalau sakit jantung, you will have evidence of cardiomegaly and pulmonary venous congestion. Okay. Now, dyspnea means difficult, laboured, or painful breathing. All right. Just now you all say increase in respiration. That's dyspnea. Okay. So often the causes is going to be left-sided heart failure, causing pulmonary edema, and then in cats, they will have pleural effusion. Okay. Sometimes this kind of dyspnea can be accompanied by stridor, and crackles and wheezes. Okay, so this one all I will teach you how to differentiate later on with videos that I will be sharing. Now, dyspnea can be paroxysmal. Paroxysmal meaning abdominal breathing. Okay, exertional meaning that dyspnea didn't happen prior to any exercise and that dyspnea suddenly occur after activity. Okay, autonomic means it occurs, there is an dyspnea, but it occurs during when the animal is just on recumbency. Okay, so dyspnea sometimes you might want to differentiate between inspiratory and expiratory, and sometimes it can be mixed. Okay, coughing and dyspnea, I would like to remind everybody, you need to really find out, is this problem a upper respiratory disease or is this a lower respiratory disease? Because both of these can give you cough, right? So you foremost needs to rule out the respiratory causes and then only you think about the cardiovascular diseases. Okay, let's move on to syncope. Syncope is a transient loss of consciousness caused by insufficiency delivery of oxygen or glucose to the brain. So there are many cardiac causes of syncope. It could be arrhythmia. The arrhythmia means the rhythms are not right. So you can have bradycardia, slow heart rate, the cardiac output is very poor, and suddenly the dog was exerting, wanting to do something, the heart could not give a proper cardiac output to the brain, suddenly faint and collapse. Okay? Or there is a ventricular outflow obstruction. Then poor cardiac output was the example I gave just now lah. Okay. Clinical sign of syncope, you have to be very careful. Have you seen a dog having seizure or a cat having seizure before? Or any humans that had seizure? Anybody? Okay. Yes, some of you all say yes. Okay, so I would then assume that everybody know how does a seizure look like. So let's look at the description of what I'm saying about syncope. Syncope can have a couple of these signs. Okay, they can have rear limb weaknesses. They suddenly collapse. Then their forelimb becomes stiff. They can have epitotonus. They might even micturate means urinate, or they may even have a clonic motion. Now, does those signs looks like a seizure or not? Those signs look like seizure or not? Yes or no?
Yes.
Yes.
So those signs, especially like forelimb stiffness, epitotonus, all right, they look like seizure, isn't it? So often owners, when they panic, they'll come and tell you, doctor, my dog seizure. So normally we will encourage the owner to take a video. If they, if they are not panicky people, they might just want to take a video. And then after that, you might want to see the videos and then differentiate. Did the dog have syncope or did the dog have seizure? So sometimes you might just want to ask more detailed question to the owner. All right, was there a hypersalivation? How long was the seizure? what happened during that period of time. Get them to describe. Then only you'll be able to differentiate whether it's seizure or syncope. So that's how we go about it lah when it comes to panicky owner. Now, again, syncope doesn't mean it's going to be heart disease, right? You need to rule out pulmonary diseases. You need to rule out metabolic. Sometimes they might be hematological issue or a neurological issue that may allow the animal to have syncope, okay, or the seizure-like clinical sign. Okay, so there are things that you need to work out before you think about heart disease. Okay, so again, there are some of the other clinical signs that we know that I don't have definition for them, that doesn't require a definition. So you will understand what is weaknesses, tiring. Apa itu exercise intolerance? Apa itu exercise intolerance?
They get tired easily.
Okay, so they don't want to exercise. All right, maybe some histories like owner say, I take my dog out to the gate. He just stood at the gate and looked at me and walked back in. Or maybe the owner say, I took my dog out. We only walk for 5 minutes. That 5 minutes he pee and then he just stand there and look at me. He doesn't want to walk anymore. Those were the days he will walk another 15 minutes or 30 minutes. So those are clinical signs of exercise intolerance too. Okay? Sometimes when they go for the walk, then they come back. All right? They had got an exertional weakness. And all suddenly during the walk, they collapse. Okay? But all those may be associated with acute decrease in cardiac output and will cause some form of arrhythmias that need to be found out lah. Okay. Fainting. Fainting is just pengsan lah. Tapi ada juga keadaan where you have cough fit. Cough, 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 syncope terus. Or cough, 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 then after that they drop terus. Okay, so these are called cough fits. And some of these cases may come in with hemoptysis, or they may be sneezing. They could look like cyanotic. They look very tired. Owner will come and tell you they cannot exercise. And sometimes there are clinical signs of ascites, and some patient will change in urinary habits. And most important thing, neoplasia, you have cachexia. Kidney disease, you can have cachexia. Cardiac disease, you can also have cachexia. In other words, weight loss. So in other words, you're going to have a patient which looks thin, body condition score, which is not good. Okay, so when these cases come in, you want to do a general examination, means you look at the patient, all right? So they normally will come in depressed, tired, lethargy, the tail doesn't wag so much anymore, okay? And sometimes these cases, when they come in, they can have stroke also as well. In other words, you will see posterior paralysis or even lameness. Okay, so some cases which are more emergency, they will come in with a respiratory posture, especially happens during dyspnea. Alright, so this patient will normally try to breathe, so they tend to have a different body conformation or stance or gait. So a lot of time they will be on sternal recumbency, and then the head or neck will be extended. Okay, they will be reluctant to lie down. So if you put the animal on lateral recumbency, it's a lot of struggle because they cannot breathe. Or sometimes when they come in, you could see their paroxysmal breathing, which is their abdominal breathing. So if they are young, they tend to be stunted in growth. They tend to look smaller. Or if it is an old dog that had got the issue for over a period of time, they may have been presented with a poor body score. Or the owner will say, he hasn't been eating very well, he's getting thinner over the day. We have looked at all the kidney parameters and liver parameters, we don't know why we can't get it to have a good body weight. Okay, so sometimes you might want to check the heart. Okay, so some cases that come in, abdominal distension, often when they have this kind of issue, it's going to be ascites. So then I will teach you how to look into ascites later on. Okay, let's move on to physical examination. So far, is there any other question? So far, anything that you want to clarify or ask? Ada ke? No, no, Azrin say good. So let's move on. Mucous membrane. Which one is normal? The center one, the left one, or the right one? Which one do you think is normal? Left one, this one. Okay, so this one is normal. This one should be called as what?
Is.
Huh? Cyanotic. Okay, you can see that it's more bluish and more purplish. This one is pure mucous membrane. So most important thing when you check their mucous membrane, what test do you always do? CRT. What the CRT stands for?
Capillary refill time.
Okay, so you're going for your CE in the future already, right? Jangan asyik CRT and then satu hari masa you masuk exam you lupa. CRT itu jap doktor, jap. Alright? It's okay to always use abbreviation, but you have to always remember CRT is capillary refill time and it should be normal should be less than 3 seconds. Okay? Okay, so that's the first thing you want to do when you look at your case. Okay. There is two different cyanosis. It's called central cyanosis and the peripheral cyanosis. So this one, you know, there's bluish gum, isn't it? So this is central cyanosis. Peripheral cyanosis often associated to the perfusion on the legs, okay, or the perfusion on the body. All right. Kalau central cyanosis, it often always means that there's an impaired oxygen uptake via the lung. The lung dah sakit dah. The lung tak okay dah. Okay, you can have any lung diseases, pneumonia, bronchitis, bronchopneumonia, fungal pneumonia, anything, okay, that is making the patient to become dyspnea. Or maybe pulmonary edema from heart disease. Or maybe this patient cannot breathe, okay, is having a hypoventilation, all right? Or even, what do you call that, congenital diseases where blood bypass the lung. So you're going to have right to left heart cardiac shunts. They can give you cyanosis also as well. Now, peripheral cyanotic is there is excess of oxygen extraction by the tissue due to the reduced blood flow. So in this kind of scenario, it's often there is an occurrences of thromboembolism. Okay, thromboembolism of the hind limb. So this one I'll explain later when we have more of this lecture, how does thromboembolism occur. All right. So which means that the blood vessels is already obstructed by a small little blood clot. Then the perfusion here is impaired. So if this picture can show you, you can see nice pink, right? But this one all looks a little bit blue already. Okay, so you might want to make the image becomes bigger to appreciate that. Okay. So in all physical examination for cardiovascular disease, it will not be complete without a proper auscultation. Okay. So just now, I want everybody to know their valve's name. It's very important because different part of the heart on different side of the chest will give you different heart sound. Okay. But you need to know where is the heart. Where is the heart? If you remember from anatomy, where is the heart located? Where's the heart located? Near the left side. So right side no heart ke, Xuan Kang? The heart is located between the third rib to the fifth rib. Okay, this is what will be available in your textbook. Okay, so if the left side of the thoracic cavity, left side chest, then when you want to auscultate, the aorta will be here. The mitral valve, mitral valve will be here, and the pulmonic valve will be here. So which I will explain in another lecture lah for auscultation. Okay, so stethoscope is very important. Cardiac auscultation is very important, but often we move around our stethoscope and then to get to hear what is the heart sound. Okay, now the normal heart rate 70 to 180. Okay, but in large breed, they tends to be slower and it comes faster in small dogs and puppy lah. Cats even faster. But most important, heart sound, S1, S2, S3, S4. S4 is where you hear for your equine. In cats and dogs, we only focus in S1 and S2. Okay? Okay. S1 is apa? Ingat tak masa fisiologi? Ingat tak? Yes, there is a specific rate. You have learned this in your physiology. I want you to go and find out. Okay, what is S1 and S2? Okay, good. Systolic, diastolic, the closure of the valves. So most important thing, S1 is lap, S2 is dap. S1 is lap, S2 is dap. Okay? Okay, so when you listen to the heart, they ought to be having a good rate lah, normal rate. If it is good, they will give you a regular rhythm. So then if you get a regularly irregular rhythm in terms of respiration, this is also normal. This is what we call respiratory sinus arrhythmia. This will be common in dogs. Okay? In your patient, when you do the auscultation, most important thing is we do not want to hear murmur. Murmur means they have got problem already. We don't want to get an arrhythmia. We don't want to have a irregular rhythm. So if you get that, then you know that there's something wrong already. And every pulse rate, okay, and every pulse, all right, when you feel the femoral pulse, there must be one beat of heart rate. So it should be a synchronous beat. Okay, synchronous beat meaning for every pulse that you get, you definitely get a good one heart rate. Okay, and they are together, right? Okay, so how do we do that? Yeah, so I'm going to explain in this slide. So when we feel for the femoral pulse, we are actually feeling the, the arterial pulse palpation. We want to know the pressure, we want to know the rates, and we want to know the amplitude. The pressure is you want to feel whether, okay, this pressure feels good, like for normal, or this pressure is like, very faint. Okay, when you try to palpate. This I always feels that this femoral pulse, you know, when you try to feel them, it's like your Chinese sincere. Okay, they always, you know, or your Korean movie, you always get all this medical doctor or the Chinese movie, Taiwan's and stuff like that. They're always feeling the pulse of the emperor, always asking for the medical officers to come in and feel in pulse. So when you do that, you're also a Chinese sincere, right? But you're not giving treatment, okay? But you always feel pulse because you want to know whether the circulation is good or not. So for animal, for cats and dogs, it's always the femoral pulse. Okay, so you feel for the pressure. The rate means pulse, how many times it was beating. So you might want to count in 10 seconds or 15 seconds. And then you times 4, you get per minute pulse rate. So amplitude means, is it hyperkinetic, is it hypokinetic, or is it regular? Hyperkinetic, when you feel the pulse, is like bounding. It's so easy to feel. You don't have to do anything, you can feel the pulse already. Hypokinetic is like, mana pulse ni? Tak feel pun. Then you get another person. I think I feel lah, but it's like very, very, I can't really feel it. You know, that's what it means by hypokinetic. If it is irregular, meaning it's not synchronous to the heart rate. The heartbeat was beating once, then no pulse pun, heartbeat beating once, suddenly got a pulse. So that's what it means by irregular. Okay, but by right, if everything is normal, it's supposed to be strong and synchronous with a heartbeat. Any questions so far? Okay ke? So this is the definition for the femoral pulse. Normal, bounding, weak. Okay, normal, hyperkinetic, hypokinetic. So weak pulse can be due to low blood pressure. Okay, can be because of low systolic blood pressure secondary to poor cardiac output. So animal in hemorrhagic shock, or they may have be heart disease, or they're losing blood, istilah hypokinetic. Kalau dia bounding pulse, hyperkinetic, which is the one in the middle here, it can be due to high increased pulse pressure produced by low diastolic blood pressure, can PDA, or maybe it's is you are after exercising. Your nervous system is stimulated already. You are in sympathetic phase. Or you nampak hantu. Then you takut, sangat takut. Then suddenly your pulse increase. Then you can feel that, oh, I can feel my pulse. I can feel my pulse. Okay, it can be physiological also as well. I hope nobody kacau me today. So, pulse deficit means it's irregular heart sound without a pulse. All right. So you get a heartbeat. You could listen to a heartbeat, but then when you are trying to feel, you didn't get a pulse. So then that's irregular. So you call that as a pulse deficit. Okay? Faham? Yeah. Okay. In terms of respiration, normal respiratory rate should not go beyond 30. Okay, if there's anything, your respiratory rate is 30, then there is a problem. Okay, but if a dog that comes to me in the clinic is panting, all the way, but he's happy, doesn't mean that that is also called as tachypnea, but that one is normal It's like anxiety and excitement. Okay, so you really need to differentiate whether the tachypnea is a physiological changes or whether the tachypnea is actually related to the heart and lungs. Okay, so the other causes of tachypnea could be left-sided congestive heart failure, or can be pulmonary edema or pleural effusion. Okay, then tachypnea is rare in right-sided congestive heart failure, except for if the patient has got pleural effusion. Okay, again this is physiology right? If they do have a respiratory diseases or an issue, their upper airway or lower airway needs to be investigated. Okay, or they may have a neuromuscular disease, all right, or a metabolic disease producing acidosis. Okay, so the animal is actually having respiratory acidosis. That too can initiate tachypnea. Okay, so in dyspnea, you need to differentiate whether is this a inspiratory dyspnea or maybe expiratory or inspiratory dyspnea. Inspiratory dyspnea, the often causes is pleural effusion. Okay, so for pleural effusion, in cats, it can be left-sided heart failure or right-sided heart failure. But in dogs, okay, it's only in left-sided heart failure, but it's a pulmonary edema. So if there is a inspiratory dyspnea in dogs, it can be because of right-sided heart failure, but it's very rare. Okay, it's very rare. So this one you can consider this point is not important to remember. Okay, then again if it is going to be pleural effusion, then that means that there's something wrong within the pleural space. Okay, this pleural space can be occupied by mass, fluid, or even abdominal organ. All right. So if there is an inspiratory dyspnea, then there could be a obstruction of the upper airway. It's a extrathoracic issue. Now, if you have both inspiratory and expiratory dyspnea, a lot of time it's going to be pulmonary edema, cats and dogs with left-sided heart failure, or maybe there is a lung issue, bronchitis, pneumonia, bronchopneumonia, fungal pneumonia, bacterial pneumonia, aspiration pneumonia, you name it. Okay, so which means further investigation is required. So you need to find out this dyspnea, jantung ke, lung ke, kalau lung, apa pattern? Okay, so this is where Dr. Lau's knowledge comes back in. There are at times jugular vein distension in cardiovascular diseases case. Okay, so this one, all you need to do is for the neck, you might want to extend the head up. Okay, then you get your jugular over here. Okay, so all this description that I've put here is you just have a read about it. I don't think I will ask you this into your examination, but for jugular vein distension, it's often due to right-sided heart failure. Okay, there's something wrong on the right side. There's an impaired venous return to the right side of the heart. Then they tend to be distended and also collapse. So you angkat itu kepala naik sahaja, you don't even have to apply any pressure. The jugular is there already pulsating. So maybe in your practical, I will show you some video lah for you to have a look at. Okay? Okay. What is there available in diagnosing heart diseases? So VPK 3614 is meant for me to talk to you guys about all those diseases across the board for cats, dogs, ruminant, equines, and maybe other smaller animal. But for me, in the ruminant, kalau lembu kan dapat sakit jantung, slaughter dah. Kalau kambing dapat sakit jantung, sure sudah slaughter dah. So a lot of time there's no workup for all those sheep and all those cow, right? Small animal in rabbits and stuff like that, we do work them up, but their workup are pretty limited. So hence, in the lecture notes for 3614, most of it I will focus on small animal lah. Okay, so radiograph is needed. Kalau if there is a radium that is, gone haywire, you listen to the rate, then you say, Dr. Khor, jantung dia punya bunyi kan, itu loop a bit weird one. Sekejap loop, tak tahu loop mana sudah ada loop. Okay, so you know that there is an arrhythmia. So okay lah, I'll just tell the student, what ECG? Cuba tengok, what is the rhythm pattern? Then let's say, yang ini paling semua orang sangat suka sekarang because time-time COVID ini. You want to see your oxygen saturation is how much. So you want to do a pulse oximeter. So and then this one, this pulse oximeter is always being attached whenever you're doing surgery for monitoring of the patient. Okay, so then you will hear the word beep, 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 then you get the pulse, then you know the oxygen, how good is it, what is the perfusion, what is the circulation like. Okay, so you will also want to check for blood pressure. For me, this is a good skill to attain, something that you might want to do routinely for all the respiratory issues and cardiovascular issue. Okay, now just now I keep on saying distension of the abdomen kan. So you might want to elevate that problem. You might want to reduce, to help the animal to breathe better. You might want to do a synthesis. Okay. So in any cardiovascular diseases patient, it's very important to run a blood and serum biochemistry profile. Okay. And there are also some cardiac biomarkers that can be used for these heart diseases as well, which is something I will not focus in this part sections of the lecture, maybe in your canine and feline medicine. So, but I would like you to know that there are something called as cardiac troponin I and cardiac biomarkers such as NT-proBNP. Okay. So thoracic radiograph, what value does it give? It allows you to evaluate the lung. Okay, so you look at the pulmonary parenchyma. You look at the blood vessels. You look at the heart, the shape and size. Yang ini semua Dr. Lau dah ajar kan? Betul tak? Cakaplah betul. Okay. So normally the indication would be any patient which are having dyspnea, tachypnea, coughing. Okay, you want to see the lungs. Then if you think the rhythm is not okay, you want to do an ECG. We will have a class on this, or maybe even a little bit of the lecture later. All right. Blood pressure, this is very important. Okay, so you might want to do a BP, but for cats and dogs, we often focus on systolic arterial pressure. 120. Okay, 120 is the normal one, but there is another ACVIM paper which I will share maybe at the end of the day. It will tell you that when you want to treat the patient, the systolic blood pressure must be 140 and above, then only you start treating them. Okay, so 120 is fine. So meaning 120 to 140 is fine lah. Okay, so what's the indication of doing blood pressure? Is when you think there's going to be an alteration in the blood pressure and it could be potentially modified by the heart disease. So in some cases, there are hypertension. Okay, hypertension, like you hear like my father and my mother, both of them also BP very high. So they need to be on their hypertensive drug. Then only they'll feel better. Okay. So when you think there's certain diseases that will contribute hypertension, you might want to check it. Then only you do your blood pressure check. All right. And sometimes you might want to also identify any individuals with hypotension. Okay, so and it's often associated to low output failure, or the patient has gone weak, or they are collapsing. Okay, you might want to check their BP. Okay. Synthesis, removal of fluids from the peritoneum pleura or pericardium. Okay, the outline or the selaput around the heart. Okay. We need to do this is because we need to elevate the clinical sign. Often these kind of cases, the animal will be having difficulty to breathe. Okay, their belly is so big. They look like a dog initially. When they have ascites, they look like a pregnant goat. Okay, this is always how I picture them. And then you need to perform a physical examination properly to identify whether is it because of fluid. So if it is really because of fluid, then we need to do a synthesis. We need to tap it out. So then there are calculation of how much you can tap also as well. But when you tap it out, right, you get maybe 3 liters of fluid from the abdominal. Wow. But janganlah throw inside the sink. Okay, so all this fluid, you then need to see, is it hemorrhagic? What is the color? Is it yellowish? Okay, is it transudate? Is it exudate? Why is it looking like white color? Is this cloud? So often when you get this kind of fluid, you will take a sample and then you will do a fluid analysis. Have you all learned about fluid analysis? Dengan Dr. Hazilawati? Dah ke? From CPS. Okay, so you know what is the fluid analysis? So important tonight, maybe you want to go and flip that particular little notebook of yours. And often how do you differentiate fluid analysis is all in a one table form, maybe one page only. So you might want to know, is this transudate, modified transudate, exudate, how? If it has got blood, what are the characteristics? How do you differentiate? Do you differentiate by the cell count? Do you differentiate by SG? Just have one glance, all right? Consider this is like revision, okay? So again, in congestive heart failure, it's always transudate. Sometimes you can get modified transudate, but a lot of time, transudate. So if you think the case is going to be a heart disease, echocardiography is warranted. Holter monitor are often when patients do have arrhythmia that needs to be investigated because you want to administer antiarrhythmic drug. Then only you put the patient on a Holter monitor. Maybe one day in the future you want to do your latihan industry overseas or stuff like that, or you have graduated and you decided to specialize, and there are many facilities out there in the world with hospital that does invasive diagnostic investigation. Okay, for normally you will need a C-arm. C-arm, CT, there are very high enough and sophisticated enough for cardiac catheterization. Okay, so these are extras lah. All right, now echocardiography is an ultrasound of the heart, and this information or this knowledge was not imparted to you when Dr. Lau was teaching you diagnostic imaging. Okay, so it's a special skill. You know, it's not something that we expect the student must know as a day one competency. But for me, my requirement of you as a student is to be able to identify all those images, okay, which we will have our lecture in maybe a couple of weeks' time. Okay, so echocardiography is an ultrasound of the heart where you can assess the internal cardiac structures. So just now we name already kan, valve nama apa, wall kat mana, this is right side of the heart, this is left side of the heart. So that anatomy is actually very important for the echocardiography. Okay, now this ultrasound of the heart will also assess the heart function, the mechanical function. Are they contracting well? What is the output? What is the pressure looking like? Okay, so the indication of echocardiography would be any animal that is suspected of having heart disease, and echocardiography will provide a definitive diagnosis. Okay? But it's antemortem lah. Antemortem definitive diagnosis. So this one we will teach. But echocardiography got two types. One is transthoracic, one is transesophageal. Transthoracic means you put the animal on lateral recumbency and you put a probe and introduce underneath, and then that's where the heart lies. Transesophageal means you have to perform under GA, and then it will allow a better assessment structure of the heart base actually. Ini pun heart base boleh assess, tapi maybe this will be better lah. But again, this one have to be done under GA. So they put a probe, okay, into the esophagus. Sorry, they put a probe, I think, on the esophagus. All right, then the probe goes under the probe will just follow and go and then scan the heart from inside. Okay, so a lot of time heart base is very important. So they will give you a lot of information over here. Okay, but normally people don't do transesophageal, and then a lot of time it's more for research purposes or something else. Okay, and normally if you have got a patient which is having heart disease, you wouldn't want to go through under GA also as well. The risk is very high. Okay, so these are the images. All these images we will share later on when we have our class and also a practical. And Holter monitor. Holter monitor, now ECG takes information, say maybe a few seconds, maybe 3 minutes, 2 minutes, or maybe 5 minutes during that period of time. When do you use Holter monitor is because you want to document the electric activity of the heart over 24 to 48 hours. So what's going to happen is the animal will then be prepped. They will shift their fur away. Then they will put all this little probe. And this thing will attach to all this little probe. And then kita balutkan dia dengan pakaian atau kita balutkan dia dengan bandages. So they go home lah with a vest. Okay. So what they do is they go home with a vest and with this entire thing. And then also have a recorder, which is this one. And then they poo, they pee, they sleep, they eat, they play and everything. All their ECG trace is going to be recorded for over that period of 2 days or maybe more if warranted. Okay. Now, this is only a very good tool for preclinical dilated cardiomyopathy. You want to see if this patient do have DCM, but they are not showing you any clinical sign. So that's what it means by preclinical. No clinical sign, they are very healthy. You want to screen them, okay, to see if they have DCM. Or sometimes you want to use this tool is because you want to initiate anti-arrhythmic drug. Okay, so you want to see the ECG pattern or the abnormal, ECG pattern that you saw. Did it got better after the anti-arrhythmic drug that was given? Okay, or sometimes you want to adjust the anti-arrhythmic drug. All right, you want to assess the efficacy of certain drugs that you have already given. And again, you want to do a 24 to 48 hours, okay, monitoring. Okay. So in human, banyak orang yang guna event monitor ini. Okay, that's because, they said that, for example, somebody will say that, I've got chest pain, but, check everything is okay. Cardiac troponin is fine. That 5-minute ECG is fine. That stress test that human will normally do is fine. But dia masih kata dia ada chest pain at certain hours of the day. So then the doctor will then plug them on in this. Okay, bandage them up also as well. And then ask them to wear this and tidur lah for tidur jalan. They will analyze what happened at what point of time. So then dia akan tanyalah, uncle, you balik rumah ada sakit tak? When did you feel not well? Then he will just say lah, okay, got on that 21st of don't know when. It was at 10 o'clock. I think I feel very uncomfortable that time. So they will go and see all those trays and then go and see that specific time what's wrong with the uncle. Was the heart okay? Okay. So that's how they use the Holter monitor. Now in cardiac catheterization, again, this is an invasive thing. But I think it's a very normal thing for human being. You know, like if you've heard, some people have gone for their angiography. They have gone in for balloonings and stuff like that. But unfortunately, this technology is not vastly used for the small animal. Okay, so if there are cases where there's complicated congenital defects, right? They might want to check the intercardial pressure, or they might want to do an angiography. All right, so they will go for cardiac catheterization now, or if there's any correction of the congenital heart defect, they might want to opt for cardiac catheterization. Okay. So the other diagnostic that you can also do is there are certain diseases where causing a lot of infection. You might want to find out what's wrong, what infection, what is the cause of the disease, like endocarditis. Then you might want to do a blood culture. Sometimes we tend to lose our patient also as well. At the end of the day, postmortem. Okay, so this is a cat heart, and this is a normal picture of the muscles lah, the myocardium, the myocytes. Okay, and this is the nucleus. Okay, they all look parallel, aligned one to each other. Okay, so by right, all these myocytes, they're supposed to look like that lah. Okay, now that's just summary. I have another more 20 minutes to go. So far, any question? If not, I'm going to start ECG. Okay, Haziq say okay. How about other people? Haziq Mira say okay. Come lah, we start a little bit lah. Otherwise, next week is ECG, ECG, ECG So what's gonna happen now? You're gonna hate me. ECG 2 hours, then practical ECG another 3 hours, or 5 hours ECG. At the end of the day, you don't see star. All you see is gonna be lines. Trust me you will only see lines, and then you're gonna hate me. Ini Dr. Khor punya pasal lah. Aku sudah pening. Alright, joke aside. Electrocardiography. Electrocardiography is a recording of the electrical activity of the heart, but you're doing it from the surface of the body. Okay? Indication, irregular heart rhythm. Can be that the heart rate is too fast. Labdab, 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 labdab. Or the heart rate is too slow. Labdab, labdab, labdab. Okay? Or you want to put your animal on a critical care and it was coming out through anesthesia, you want to monitor the recovery. All right, then you might want to put them on ECG lah, because you Students, am I back?
Yes, Doktor. Now we can hear you.
Wow, not only I know my background is so cool one. I'm actually at the radiology room. So you might hear dog sound and stuff like that. Alright. Okay, can we continue? Okay, just now I stopped recording already. Let me share back again. Okay, then I will record. Okay, the recording didn't stop. Okay lah, we can continue lah. Okay, boleh ke?
Yes,
Am I still
Doktor.
around? Okay.
Yeah. We can hear you, Doktor.
I'm going to do this all from home. I'm not going to stay in the faculty. Faculty has got very poor line. Okay, so just now I was kicked out lah. Okay, in ECG, you're actually measuring the pacemaker cell. Okay? So, SA node transmit to AV node. AV node will then transmit to Purkinje fiber. Okay? These are the important node, SA node, AV node, then Purkinje fiber. Okay? Can you hear the dogs? Can you hear the dog barking?
No, doctor.
Okay.
Doktor.
Okay, I shall continue. So electrocardiography is evaluation on the anatomic changes of the heart. But I can tell you, it's useless. And then ECG can tell you cardiac arrhythmia. Yes, it's good. And ECG allows you to evaluate your cardiac therapy and the progression of the disease, and sometimes can tell the prognosis. Okay. Now, ECG can sometimes also differentiate the non-specific diseases caused by weakness, syncope, collapse, and seizure. Remember just now when I say you syncope and there is seizure, you need to differentiate. Sama ada dia sakit jantung ke, metabolic disease ke, respiratory disease ke, nervous system diseases ke, betul tak? So, ECG is very specific for the heart. So, dia bolehlah differentiate lah. Okay? Right. And you use ECG when you are monitoring the cases. Okay, this one I've said it just now. Now it's an external recording. You want to record the electrical function within the heart, but you're measuring from the surface. This is how it looks like. So terminology, very important. What is electrodes and what are leads? Electrodes is this one. Okay, a probe connecting the animal to the ECG machine. Leads are angle from which an ECG signal is being read. Inilah lead punya maksud. Okay? So this one is very much physiology. I know you hate me now because you're so hungry. And I'm also very hungry. So this is lead towards positive leads. Positive leads. Okay? This one sudah kontra kan? Balance out already. Okay? Negatively deflected. Ini betul punya negatively deflected. Okay. Now the heart is composed of so many cardiomyocytes. Alright, and they repeatedly depolarize every minute. Okay, so each cardiac depolarization produces a wave of negative charges along the surface and has a direction of alignment. So that's what it means lah. Positively deflected or negatively deflected. Okay, that's what you term it as vector. Alright, now collectively, they have net vectors in three-dimensional space over time. And depending on where the electrodes are being placed, the deflection will provide different perspective on the electrical depolarization and repolarization of the heart. In this particular next few lectures, I'm not going to be focusing so much on physiology, where Dr. Goh has already touched on. Betul tak? Hello? Betul tak?
Betul.
Okay? So or go back and do your revision about depolarization and repolarization. But these are the things that actually make up what is the information from the electrocardiography. Okay, now leads are comprised by a pair or groups of electrodes. This one, like that one, lead 1. Like that, lead 2. Okay, this one is electrode. Tapi kalau dah 2, macam ini punya, then you call this leads. So lead 1, lead 2, lead 3. Lead 1 is right arm, left arm. Lead 2 is right arm, left hind. Lead 3 is left arm, left hind. Okay, so there are actually 6 standard bipolar limbs. Okay, so which are arranged around the heart. Okay, this is the heart sitting here, arranged around the heart. Okay, in other words, they term it as Beethoven triad in the frontal plane. So you have got lead 1, lead 2, and lead 3. There are also augmented leads. And these augmented leads are the AVR, AVL, and AVF. Okay? So meaning you will attach the ECG, sinilah. This one will give you the AVR. Like this one will give you the AVL. Like this will give you the AVF. Okay? But for me kan, you Dr. Khor ni pening lah. In cardiovascular diseases for cats and dogs, paling penting ialah lead 2. Okay? You die, you cry, don't know what to do. You just say lead 2. So which I will explain why. Itu Venn triangle tu. Tadi kita kata right leg, left leg. 4. Lead 1. Okay? Lead 2. Right 4 to left hind. Left 4 to left hind. So when they put them into a triangle, they put them together, it becomes a triangle. Lead 1, lead 2, lead 3. Okay? Lead 1, lead 2, lead 3. So this line, ke tengah, ke tengah, ke tengah. Semua bertemu. Lead 1, lead 2, lead 3. Ya. Ini balik rumah you tengok ah. Okay. So dia jadi lead 1, lead 2, lead 3 kat situ. Lead 1, lead 2, lead 3. Okay. This one very important one lah. Because we will need how to do calculation. Untuk apa? Nanti kita cakap next week. Okay. This one Dr. Khor dah, Prof. Khor dah ajar loh. Atrial polarization, your PR interval, your ventricle depolarized. You get your QRS during this time. Everything is rested. Okay, so you get your ventricular repolarization. So you got the PQRST. So you need to sing the PQRST. So next week, Wednesday, we will sing PQRST whole day. Okay, you need to know how they look like. Okay, all right. So this is normal heartbeat, fast heartbeat, you get a lot of ECG trace. Slow heartbeat, maka when you document it, slow lah, kenapa slownya? Alright, when you have irregular beats, this is what you see lah. Okay, PQRST, 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 PQRST. Okay, alright. So again, what you're measuring, the pacemaker cells and the cardiomyocytes. Okay, so what you need to do is to see the rhythms and rate. That's what we will calculate. Okay, this one I don't want to go through. This one is all definition. This one Prof. Khor dah ajar. Okay, so this is going to be revision. Okay. Okay, this one is important. And it's already 1 o'clock. I think we stop here. It's actually the last slide. Okay, I think we continue. Boleh ke? I'm sorry, guys. So, we already know lead 1, lead 2, lead 3. AVR, AVL, and AVF. So, in the Beethoven triangle, and then the hexahedral lead system was then created. So they pusatkan everything kepada tengah. This is the jantung. So lead 1, lead 2 kan macam ni. So dia jadi kat sini. Lead 3 is here lah. Okay. That's where they measure here to here. Okay. The mean electrical axis is the direction of the net ventricular depolarization. Sini atrium kan, sini ventricle. Sini atrium, sini ventricle. Okay, in the frontal plates. This can be calculated by adding the vector of any two leads vector of the ventricular depolarization. It can be used to aid detection of ventricular hypertrophy or conduction abnormality. Okay, mean electrical axis cuma beritahu you mana ventricular hypertrophy atau any other issue. So in dogs, the MEA is 40 kat sini to 100 kat sini. In cats, dari sini, fiu kepada sini. Okay? Ventricle lah, it only measures the ventricle positioning. Okay? So the ventricle, the point of the heart, the lower part here, the ventricle can point here, it's normal for a dog. Kalau dia point here, the ventricle point here, then you know it's abnormal. Okay, otherwise it must be between 40 to 100. Okay, in cats, then this mean electrical axis is actually useless lah. Okay, you cannot have the heart upside down ma. If you have the heart upside down, means the ventricle is going to be here. Alright, this is just a joke lah for you all to remember. So the ventricle can, you know, be pointing from 0 to 160, which is over here. Okay. Now, in dogs, mean electrical axis is typically approximate at the direction of lead 2. Okay. Dogs kan kita punya jantung like this one, and then it normally points to lead 2. So that's why lead 2 is very important. Okay. Any choice of interpretation? Kalau dia punya machine has got only 2 to 3 liter electrodes for you to put onto the animal or whatnot, paling important, you don't know how to read, you sit down there and cry, you only look at lead 2. Okay, jadi doktor vet sangat bahagia tengok lead 2 sahaja. Jadi doktor manusia nangislah kalau tengok ECG. Okay, because they have got 12 leads to read. Okay? Alright, student, any other question? So far okay ke? We've extended a little bit, it's 5 minutes. But next week, the lecture notes are already there. Haziq, don't cry. Asyik cry aja emoji dia. So please look into the ECG lecture notes before we start, so that at least masa tengah lecture itu you tak hilang. Not like hilang from this virtual class lah. I mean like you tak sesat. And then if there's anything that needs to be corrected or needs to be panggil apa, ada pertanyaan, then straight away we can troubleshoot it. Okay, students? Okay kah? Saya lapar ini, tak ada orang jawab okay pun.
Okay, doktor.
Okay,
Okay,
doktor.
doktor.
Okay. Alright, bye-bye.
Alright, doktor. Have a good lunch, doktor.
Thank you, doctor.
Thank you,
doctor.
Thank you,
Thank you so much,
Thank you,
doctor.
Thank you so much, doctor.
Okay, same to you all too. So I'm gonna stop the recording and bye-bye.